Hello, and welcome to the NBMT Link webinar, Survivorship, Tried and True Advice. At this time, all participants are in a listen-only mode. A question-and-answer session will follow the formal presentation. You may ask a question at any time by typing it into the Ask a Question feature on the left side of your screen. As a reminder, this conference is being recorded. It's now my pleasure to turn the call over to Jennifer Gillette, LMSW with NBMT Link. Please go ahead, Jennifer.
Thank you, Kevin, and thank you for always helping us with these webinars. We appreciate you, and welcome everyone. Today we are joined by some amazing speakers to talk to you about survivorship and have some great tips and advice for you. So I'm glad you're here to join us on this webinar today. As Kevin had stated, this will be recorded. And so if you want to go back and listen to it again or print slides, this will be on our website within the week. So that will be available to you. Okay, just a basic outline of how we're going to look today. I'm just going to tell you a little bit about the link just in case anyone has not heard of us before. And then we are going to have our nurse practitioner speaker, Abby Champa, who will be talking about survivorship, lingering side effects, and health surveillance. And then Regineak Ruffin will be joining us from LLS, and she will talk to you about thriving as you accept the new normal as a survivor, as well as advocating for yourself. And then we will be joined by Todd Brown, who is a 10-year survivor of multiple myeloma, and he's going to share his perspective and tips. And then we will open it up for questions. Kevin will give you some more detail later on about asking the questions, but if you look at, I believe it's the bottom of your screen, there should be an area that you should be able to ask questions, and you can even type them in as the program's going, but we will get to those at the end of the program. So for those of you who are not familiar with the National Bone Marrow Transplant Link, our mission is dedicated to helping individuals and their families from diagnosis through survivorship. We work with hospitals, cancer centers, and other organizations to reinforce and complement medical care by providing resources, support, and education. I have some contact information on this slide. If anyone feels that they could use some extra support, please feel free to reach out, and we're happy to connect you with some of our great resources. And some of those resources are on our website at nbmtlink.org. We have past recordings of our Lunch and Learn programs, and we have those every month as well on a variety of topics. We have our podcast series, Marrow Masters, that we have over 8 seasons, and we're working on number 9 on all kinds of wonderful topics. We have webinars like the ones you are on today, and we also have blogs from survivors and caregivers, and all those who have been through this process. We also have disease-specific information, more survivorship issues, and then coping and symptom management. We have our peer support mentor program for patients and caregivers where you can talk to others who have gone through this. And we have our Second Birthdays Recognition program. We also have a variety of books and materials that we can send you. And we also have emotional support and referrals that we can give you for things such as financial assistance, etc. We also would like to thank those sponsors that made this program possible today, the Leukemia and Lymphoma Society, Sanofi, and of course our esteemed Link partners for their continued support in all that we do. Just a little brief note that any of the information you receive today is not specifically intended for you to replace any of the medical information by your providers. It is general information that can stimulate conversation with your provider. So now a little bit about our speakers. First, Abby Champa is a nurse practitioner in the Survivorship Clinic at Dana Farber Cancer Institute. Throughout her 18-year career, She has cared for patients across disease centers. She's passionate about caring for patients at any stage of their cancer journey. And as a provider in the survivorship clinic, she feels lucky to be able to ensure that her patients' care post-cancer remains comprehensive and complete. She attended Mount Holyoke College for her undergraduate studies and the MGH Institute of Health Professions for her graduate work. She lives in the Metro West area of Boston with her husband and 3 children. And then we are joined by social worker Regineak Ruffin. She is an information specialist in the Leukemia and Lymphoma Society's Information Resource Center. She earned her master's degree in social work from the Clark Atlanta University and was awarded her Bachelor of Arts in Child and Family Studies with a minor in psychology from the University of Louisiana of Lafayette. Regineak is a current doctoral student at Walden University, earning her Ph.D. in social work while studying African American college students' help-seeking behaviors and the implications for social work practice. Regineak is skilled in providing in-depth psychosocial support and disease education to those affected by blood cancers. Her expertise includes mental health and oncology social work. In addition to her work with blood cancer patients and their families, she also has experience working with children and adults with psychiatric diagnoses. And then we have Todd Brown, our survivor, who is going to be sharing about his story and the tips he has learned along the way. And so now, to begin the educational part of our program, I would like to introduce you to Abby. And there you go, Abby.
Thanks so much. Thank you for the introduction. As Jennifer said, I'm a nurse practitioner at Dana Farber, and I do see patients of all prior cancer histories, but today I'm really excited to speak about post-transplant survivorship care. So I just wanted to briefly discuss how we think about a cancer survivor. How is this defined? And concretely, this is a person who's had cancer, but also includes their loved ones. And in the clinical setting, or sort of practically speaking, the field of survivorship focuses on people who have been through cancer and maybe either in a watch and wait period, maybe stable on chronic medications, or people treated and cured but are living with the aftermath of cancer. The term is meant to capture a broad population rather than a label. And I do recognize and do see this in my practice that the term survivorship doesn't resonate with everyone. It is part of the evolution of cancer survivorship. It was when the National Coalition for Cancer deliberately changed the term cancer victim to cancer survivor to really bring about a change to the notion of the experience of living with, through, and beyond a cancer diagnosis. So we think about cancer survivorship as really spanning the cancer journey. Just as when we treat a specific cancer, we don't treat every individual with that cancer with the same treatment. And the same is true for survivorship. There will be different needs that vary amongst cancer survivors, and we're careful not to take the one-size-fits-all approach. Early on, survivorship care really suffered when trying to focus on absolutely everything. And what we've learned is that we're much more successful in tailoring care to the individual. It was in 2005 when the Institute of Medicine highlighted a report that was termed From Cancer Patient to Cancer Survivor Lost in Transition. And what this highlighted was that cancer survivorship care in the U.S. was lacking. Cancer survivors were falling through the cracks in our healthcare system, and the report provided a blueprint for the standard of care that should be considered for all cancer survivors, no matter where they are in their journey. Out of this came many iterations of different requirements, and currently the newest standard from the Commission on Cancer regarding survivorship and survivorship programs is 4.8. And this really focuses on the development of a survivorship program to meet all of the needs of the cancer survivor. And this includes having a dedicated program director, a dedicated team to deliver very specific delivery care models and meeting the needs of people wherever they're at. And this is done through consultative services that I'll get into in a moment, either on-site or by referral. Additionally, the survivorship program, in trying to meet the needs of all patients, should have both medical and psychosocial supports for patients. So in addition to, of course, screening for the prior cancer, this should also include programs such as nutrition, sexual health, fertility, support groups, and all new patients to a program like this should receive a document called a treatment summary plan, which I will get into in a moment. Although that's not a requirement of the standard, it is something that we feel is very important, and I'll explain why. If this is something that you're curious about in terms of these services, it would be important to ask your current team if they exist in your area. Not all programs will have every single one, but we feel in general that these are the facets of care that do help address all the needs of a survivorship patient. So the models of survivorship care, as I mentioned, should be tailored to the individual. The one-size-fits-all approach really didn't work initially when people started to look at cancer survivorship overall. And this could be at both the patient level in terms of the individual needs, this could be the type of disease someone had, or even at what area they are in the country based on what is available to them through their healthcare system. So it's a broad foundation to start delivering individualized care. And so there are four major areas of focus in cancer survivorship. We think about the first one being recurrence and new cancers. People focus on, is my cancer really gone? What are the risks for recurrence or another cancer? Did the treatment that was given to me to cure my cancer carry any risk for me down the road? For some cancers, we think about, is this a genetically driven cancer? Should I have what's called expanded panel genetic testing now that that's available and it wasn't available when I was diagnosed? So that's one area of cancer survivorship focus. Another large area is modifiable health behaviors. These are things that we think about regarding diet, exercise, smoking, things we know we should do more or stop. For example, in the colon cancer population, we know that a diet high in good fats, fruits, and vegetables is associated with doing better in terms of cancer recurrence. Exercise and weight management is also important in terms of health behaviors. So these are the things we try to focus on in our clinic, looking at how someone lives and trying to offer adjustments to their lifestyle to help mitigate risk. Coordination of care is a big bucket in the focus of cancer survivorship. And this means that your care is working in tandem with your primary care, maybe your oncology team, and maybe survivorship or other disciplines of your health, such as endocrinology if you have diabetes, or gynecology if you're followed there. The idea is that you're coordinating care so that you're not having any screenings missed or any risks not looked at regarding your overall health. And the last category is long-term late effects. Anything related to the prior diagnosis, the treatment that lingers, neuropathy, fertility concerns, skin issues from GVHD, sexual dysfunction, sleep issues. This all falls into that area, and certainly depending on the individual can be honed in and addressed with the specialist. I just wanted to stop for a moment just to say that this is how we structure our bone marrow transplant survivorship clinic at Dana Farber. Again, if this is at all of interest to you, you should ask your local providers who may specialize in things like this. It doesn't have to be one large multidisciplinary clinic like this. But for the purposes of explaining this, we meet once a month. Our multidisciplinary clinic includes myself as the nurse practitioner, and the same day there's dermatology, oral medicine, and ophthalmology. The idea being that these patients who may have GVHD, specifically skin, mouth, eye-related, are being physically examined while they're also receiving broad survivorship care and I am then plugging them into other specialists by referral that we have, oncoendocrinologists, oncocardiologists, etc., to address any issues that may have become unmasked by their transplant or their treatment in any way. We also provide sexual health counseling, sleep medicine, nutrition, exercise physiology, and social work. We also have a tobacco cessation program. So as I mentioned the treatment summary plan briefly when I was talking about the Commission on Cancer current standard. And again, while it's not a requirement, this is a very important document that is a multi-page document that outlines the cancer history, the surveillance that you should have, reasons that you should call your providers, important modifiable lifestyle behaviors, as I mentioned, health guidance, and resources for cancer survivorship, both at your institution or online. I prepare this document for every new patient that I meet. It is a physical paper document handed to patients, which is feels a little old-fashioned, but serves as a way of concretely giving them a record of how they were treated. This is what is contained in it. Beyond the demographics, it's the treatment they received, the stage of their cancer, the dates of vaccinations for the transplant population, support services, reasons to call, as I mentioned, and all their care team information. I also share this with their primary care providers. So again, there can be that coordination of care. Cancer survivors often feel a variety of emotions at different times during the aftermath of treatment, and this is why a multi-pronged approach in the survivorship care domain is so important. It's really normal to feel any of these emotions somewhere along the way, and I encourage you to reach out if you're feeling any concerns, anxiety, anything beyond the physical side effects, which I'm going to talk about in a moment, to reach out to your provider so that you get the support that you need. The impact of cancer isn't just a physical one. In a moment, my final slides will show the medical things that we follow regarding lingering side effects. But there are many factors that can cause stress for our patients, and some of these are less frequently discussed, such as emotional burden in which the patient may have been the income earner in the home and is now unable to work or return to the work that they did. They may be relying on family members to bring home income and support them. This role reversal can feel upsetting or strange. There can be a financial burden, both from a medical cost perspective and the loss of income someone may have experienced. Transplant patient survivorship issues are far-reaching, again, both physical and psychological. There can be relationship strains with caregivers being stretched beyond their coping limits and having to take on the care of a loved one or take on a new job to replace income. In partnered relationships, this can cause intimacy issues or stress around that. Treatment and the transplant process may have left someone exhausted or feeling down, and the individual may have poor self-image after their body has changed with treatment. They may feel a lack of libido or interest in sexual activity. Fatigue can affect one's ability to have healthy outcomes, such as exercise. This can be an important thing to recognize in terms of health behaviors, but also from a social standpoint. If one had been very active with family and friends prior to their diagnosis and now feels too tired to take part in these activities, and this can strain relationships and can also be very isolating. The upside, I will say though, of coming through a journey like this is that some people feel very refocused on health. They feel a confirmation in their faith. They want to change their lifestyle to include exercise, diminish alcohol or eliminate it from their lifestyle, stop smoking. So it can also bring ownership and a positive turn in someone's life. The heart of what we do, and I think the most frustrating and most physically distressing to individuals, are the side effects that linger from all that they've gone through. Being as proactive as possible and telling your medical team about symptoms appearing or worsening is the best thing you can do. Don't wait and see, report it. Be proactive. This slide and my next slide outline what we generally monitor for medically based side effects. For example, if you have GVHD of the mouth, the ramifications are that you could develop dry mouth or dental issues, and you need to ensure that you're being monitored by a dentist who knows your history and that you're at least seen every 6 months or every 3 months initially. Using excellent dental hygiene and oral mouth care is crucial. Another example to think about would be your bone health. The transplant process and the chemotherapies strip away much needed minerals and vitamins, and both men and women need to understand that bone density can diminish post-transplant. Many women know about this because of a postmenopausal state, but men lose bone density too, and having bone density studies after transplant and taking vitamin D are important. You should try and eat your calcium, and if you can't eat it or you don't like it, you should take a supplement, you should take vitamin D, and use weight-bearing exercises to help strengthen your bones. Yoga, Pilates, squats, body weight. Other examples to think about would be making sure that you're taking your infection prophylaxis medications if you're still on those, and that you're up to date with your vaccination schedule. Ensuring that you haven't forgotten about other cancer screenings like a mammogram or a colonoscopy, things that we do forget about when we're in the throes of having to face a cancer diagnosis and subsequent transplant. And remembering that the treatments that were necessary to cure the cancer also may have put you at secondary risks, such as to your cardiovascular system or your blood sugar. So it's important, if you've noticed that your blood sugar is going up when the blood draws are being done, that you talk with your healthcare providers about checking your blood sugar, eating a healthy diet. And don't forget to see your primary care provider. They are a big part of keeping you healthy. Oncology cannot follow absolutely everything in the same way primary care cannot follow absolutely everything. So you must partner with them. What an individual experiences with any cancer diagnosis, and certainly with a transplant, is just the beginning of what can be a long and sometimes bumpy road. The medical monitoring and understanding that there will be psychological ups and downs, with both of those acknowledged, one will be successful. But taking advice from medical professionals can help get you the care that you need and charter the path, but it's also important to accept resources from family and friends and know that you're not alone in this. Asking your medical team about specific survivorship care can enhance this experience and this journey for you. Thank you so much.
Thank you so much, Abby. We really appreciate you sharing your expertise, and I am sure that helped many here today. And now we would like to introduce Regineak Ruffin from LLS. Thanks for joining us.
Hello, everyone. I am so honored to be presenting on long-term survivorship post-transplant. Today, I'll focus specifically on depression, anxiety, thriving as you accept your new normal, and advocating for yourself. And to start, post-transplant and in survivorship, you can expect to experience many different emotions, right? So keep in mind the psychological effects post-transplant will differ for everyone. But today we'll specifically focus on common experiences as well as ways that you can cope and gain support. And so with that being said, emotional highs and lows after transplant are common and should be expected. And so some of those emotional highs and lows, they consist of joy and gratitude, sadness and grief, anxiety and PTSD, which we will discuss further along in the presentation. And so when we think about joy and gratitude, right, we think about one end of the spectrum where you feel thankful and even this overwhelming gratefulness, for having reached this part of your journey known as survivorship. You may also experience sadness and grief, which feels as if it's on the opposite end of the spectrum. This can consist of heaviness, sometimes survivor's guilt, right? Especially when you reflect on or feel the weight of your diagnosis and the journey. Anxiety and PTSD are also emotional reactions to survivorship and to bone marrow transplants. And so for the most part, most of these emotional reactions, they don't interfere or get in the way of everyday life activities. But sometimes feelings of anxiety, worry, feeling down, sometimes these feelings persist or get in the way of activities of everyday life. And so these are known as long-term psychological effects. They are included but not limited to depression, anxiety, and PTSD. And so we'll spend some time talking through these emotional experiences as well as ways to cope. And so when we think about depression, some survivors experience depression or symptoms of depression following a transplant and into survivorship. And so when we think about a clinical diagnosis of depression, this includes ongoing sad moods and or a loss of interest in activities that you once found enjoyable. They can also include isolation or withdrawal. It also includes irritability or trouble concentrating or carrying out day-to-day activities. There may also be feelings of guilt, right? Just as feeling guilty, hopeless, helpless, or worthless. Sometimes they come with thoughts of hurting or that hurting yourself or that your family would be better off without you. And so typically to be diagnosed with depression, a diagnosis of depression occurs when symptoms persist for at least 2 weeks. Depression is especially difficult when there's an expectation of how you should respond. And so I speak with several survivors who they have difficulties because in their minds they have this expectation for how they should respond in survivorship and how they should feel having reached this part of the journey. And so when you expect to feel joy and gratitude, but you're experiencing maybe survivor's guilt, that is difficult to cope with, right? And so in that case, I always recommend to speak with your provider about your what you're experiencing so that you can gain support. And so when we also think about another long-term psychological effect that some survivors experience, anxiety, right? And so there are feelings of anxiety that are caused by the common worries encountered in day-to-day life, as well as undergoing a stem cell transplant, not to mention COVID-19 pandemic, right? And so there are many different stressors, right? And so these worries can include transplant effectiveness and outcomes, the recovery process, right? There's also the fear of recurrence or relapsing in survivorship. There are also financial stressors associated with transplant and survivorship. There are also caregiver stressors, right? Am I going to have someone to be there for me, to care for me throughout this process? And so there are a host of worries that may come up. But when we think about an anxiety disorder, this includes intrusive thoughts, extreme worry, fear, and a dread following a transplant. And so when suffering from anxiety disorder, it's difficult to pull yourself out of an anxious state of mind. And sometimes that's what can determine whether or not someone is dealing with what we call an anxiety disorder, right? It's difficult to pull yourself out of an anxious state of mind. And so when it comes to anxiety, symptoms of anxiety disorder make it difficult to perform daily life tasks. Another long-term psychological effect includes PTSD. And so in some cases, anxiety can be so pronounced after going through a very difficult experience, such as being diagnosed with cancer and bone marrow transplants, that post-traumatic stress disorder, also known as PTSD, develops. And so some of the symptoms of PTSD include bad dreams or nightmares, scary thoughts, reliving your experience over and over, feeling emotionally numb, guilty, depressed, or worried, also feeling easily startled, tense, or on edge. And so these symptoms may come early in your recovery process or later. Typically, when diagnosed with PTSD, the symptoms have to be present for at least a month. And if untreated, PTSD really can affect your relationships and your ability to function at home, school, or work. And so I know that I've taken some time to discuss the long-term psychological effects of survivorship and of being diagnosed with cancer, but I want to take a moment to discuss some ways to cope, and these are in no respective order. And so the first way to cope with the long-term psychological effects always is going to be to rule out medical, right? And so discussing what you're experiencing with your providers can help rule out a medical basis for your symptoms. The next thing that I always recommend is to give yourself grace, right? And so giving yourself grace means that you are offering yourself unconditional love and acceptance throughout this process. Undergoing a stem cell transplant and adjusting to life post-transplant and adjusting to survivorship is going to be different for each individual person. So you want to be kind to yourself as you adjust, right? Another thing that I recommend is know that you're not alone. Recovery alone can bring on many different emotions, and sometimes you can start to feel as if you're by yourself on this journey. And so in those moments, it's so important to remind yourself that there is help available when and if you need it. And so giving yourself permission to acknowledge when you're feeling disconnected or when you're feeling alone, or even allowing yourself to acknowledge when you are feeling shame, right? Asking for the help that you need is going to be so critical to your mental health. Another coping skill is to talk it out. Spend time with family and friends. Obviously, there are certain restrictions, right, given the COVID-19 pandemic on how you can connect with family and friends, and we want to be mindful, of course, and diligent about maintaining safety. However, spending time discussing how you're adjusting to life post-transplant and into survivorship can provide you with an opportunity to gain support from those who love you, right, and build connection with those who love and care for you. I also recommend acknowledging, right, so survivorship post-transplant comes with several uncertainties, which have we've previously discussed a few of those. And so sometimes it helps to acknowledge those uncertainties about survivorship, right, and choose to focus on what you can control, like your thoughts, how you spend your time, what you eat, right, and the way that you care for yourself. And so continuing with the discussion of ways to cope, this falls into the next tip, which is to stay in the present moment. Another helpful technique with coping with uncertainty, fear, and stress that may arise during survivorship is by staying in the present, focusing on the gift of today, the joy of being in the present. These can help ease anxiety about the future. It can also help you fully engage with your family members and those you interact with on a daily basis. I also recommend talking with others who have received a stem cell transplant and are in survivorship. This is another way that you can gain support from those who have a shared experience, right? I also recommend implementing relaxation techniques throughout the day. And so if you find yourself preoccupied with the future or feeling stressed or tense, implementing relaxation techniques can help you ease some of those fears and anxiety. Another tool that may be able to help is journaling what you're feeling. When you take time to journal, what it allows you to do is process what you're feeling. And as you process what you're feeling, you can start to gain a sense of meaning from those experiences. You can start to understand them a little bit better. And so journaling, for the most part, is very helpful. Also recommending reconnecting with your body, right, through yoga, meditation, deep breathing, or exercise. Cancer treatment, including transplant, impacts your bodies, right? And sometimes our bodies, well, not even sometimes, all of the time, our bodies experience and house that trauma that we've experienced. So yoga, meditation, deep breathing, and exercising are all ways that you can reconnect with your body and start to heal some of that trauma. Lastly, I also recommend talking with your healthcare team about professional counseling and or medication if those resources are needed, knowing that they're available for you. And so in terms of advocating for yourself during survivorship, some of these tips have been discussed previously by Abby, and so it will sound like a reiteration of what has already been shared, but talk with your healthcare provider and your team about your survivorship care plan, as well as late and long-term side effects and how they will be managed, right? So discussing with your healthcare team follow-up appointment expectations, right? What to expect during survivorship. This can ease some of the stress and tension, right, about what's to come. You also want to talk with your team about your risk for relapse or disease progression, as well as the signs or symptoms that may indicate a relapse or disease progression. You also may want to discuss returning to work with your healthcare providers. Other tips that I recommend: discuss ways to engage in healthy behaviors during survivorship, right? And so discuss other disease screenings, immunizations, diet and exercise, also discussing sexual health. These are all topics that should be discussed in survivorship so that you can know your role and how you can improve your health and thrive during survivorship. Also, addressing and discussing mental health symptoms, right? Not being afraid or ashamed to speak with your provider about not only the physical symptoms that you're experiencing, but also the emotional and mental symptoms that you're experiencing in survivorship so that you can access that support that you need. Lastly, inquiring about survivorship clinics and how you can connect with these resources will also help you thrive during survivorship. And so I also wanted just to bring all of this together, right? And so you'll find some of the topics on this slide are topics that have been previously discussed, but I just want to reiterate some of these things, which is giving yourself grace, taking your time, right, and offering yourself this unconditional love and acceptance as you adjust to life in survivorship, right? Also, this acceptance and gratitude, right? And it's not in terms of, thinking that everything is positive, but finding some way to find the good in today, right? Focusing on the day that you have. Also recommending making lifestyle changes to improve your overall health and well-being. These are things that are in your control, right? And so making sure that you're making good food choices, right, or joining an exercise program are ways that you can control your health. Also, I recommend creating a self-care plan that will nourish your spirit, your soul, and your body. Also recommending reconnecting with family and friends and activities that were postponed during treatment. And this is one way to, thrive during survivorship. Reconnecting with those things that you enjoyed before you were diagnosed or before you had to undergo treatment is another way to enhance your well-being. Finding a hobby, right? Something that can help occupy your mind and teach you a new skill is also a way that you can thrive during survivorship. I also recommend connecting with other cancer survivors and other cancer and transplant survivors. And lastly, finding meaning from your experience, right? And so finding meaning from your cancer experience and journey occurs when you gain a sense of meaning from what you've experienced, right? And so sometimes finding meaning comes from being there for others who are beginning the same journey that you have already undergone, right? And so that may show up as becoming a survivor, becoming a peer mentor, right? Finding a deeper appreciation for life, family, friends, right? For some, it is gaining a new outlook on your faith or spirituality. Ultimately, finding meaning is making sense of your cancer diagnosis and your experience, right? And so we don't want to rush this process in terms of finding meaning. It will come to you, and not everyone wants to find meaning, and not everyone will. And so there is no pressure in doing so, but several survivors speak to the importance of it and how it has transformed the way that they experience their lives and survivorship. And I wanted to lastly end with just some resources through LLS that you can connect with if you find yourself in survivorship and are needing some support, right? And so we offer publications we offer a survivorship workbook that really lists out ways to advocate for yourself with your healthcare team, ways to improve your health and well-being during survivorship. We also have side effect management booklets that can help you anticipate and discuss ways that you will manage long-term and late effects with your healthcare team. We also offer support resources that come in a form of group support and one-on-one support. And we also offer information specialists who are always available to speak with you, Monday through Friday from 9 a.m. to 9 p.m. Eastern Time if you are in need of additional resources. Thank you so much.
Thank you. Joining Jennifer.
Hello, my name is Todd Brown. I'm a survivor. I'm not a healthcare professional, and I have not conspired with Abby and Regineak on some of the points we're going to talk about, but I think you'll find that some of this is repetitive. I was diagnosed in 2012, and I've had 2 transplants. And I try to remain as positive as I can, and I have some points for you to think about, mainly things like pre-transplant. And as has been said before, you're not alone in this journey. There are others who have come before you, and fortunately or unfortunately, there will be others that come behind us. Your medical provider will have a team of professionals that will help you through this journey. You've got doctors, PAs, psychologists, social workers, dietitians, people that can help you with financial help, clergy, physical therapy, and pharmacists. They're all there to help you. And I'm sure along your journey, you're going to find other patients or mentors who can help you down this path. I liken my first transplant journey as being in high school as a freshman. The first day at the clinic, you kind of feel like you're a freshman and you don't know where all the classrooms are. You don't know the quickest way across the campus. You're not sure where the best study hall is or the back. And as you wander through the transplant journey, you meet some other people, you meet some sophomores, juniors, and seniors, and pretty soon you realize that you know the shortcuts, you know where to eat, you know where the best blood technician is that can draw your blood and not cause you any pain. And you start to give that advice to other freshmen. And then all of a sudden the doctor says, well, the transplant's done, and you're ready to go home. And it's kind of like graduation. And all of a sudden you're kicked out of high school, or you're allowed to leave and go home from the transplant clinic, and you're kind of back on your own again. But there are others who have been there before, so you're not alone. Ask, seek out some help. The other thing is that you don't have to suffer. The medical team has seen all the issues that you may be experiencing, but they're not going to know wrong unless you tell them. You know your body the best, and you know when something is off, mentally or physically. And to brew about it for a couple of days before your appointment and then go see your medical professional, and don't tell him or her that you're hurting or you're worried or something isn't quite right, doesn't help your cure your ability to get better and recover faster. The other thing that I found with my wife, my caregiver, is that we kept a notebook of every appointment, every time my temperature went up or down, or if I had constipation or nausea, so that when we did talk to our medical professionals, I could relate to them exactly what happened before or after a particular treatment. The other thing is, you need to be able to confide in someone about what you're feeling physically and or mentally, the stresses, the fears, the angst, whether it's your caregiver, a friend, a clergy member, a spouse, a sibling, a stranger. Sometimes you just need someone who will listen. My first transplant was at Seattle Cancer Care in Seattle in 2012, and I met a gentleman from the Pacific Islands, and he was there by himself. He had no one to talk to. And after a Seahawks game, he approached me and he said, "Can I talk to you?" And I said, "Sure." And we sat there and had an hour and 10-minute conversation, and I just listened. And at the end, I offered a couple suggestions on talking to a social worker about a situation. but he had no one he could just unload on or fears or concerns. And as a transplant patient, you need someone. As you prepare for the transplant, most all of the cancer drugs attack warm and fast-growing cells. And if you condition for your transplant with melphalan, it's the best. It will attack every fast and warm cell. And your clinic will tell you to suck on ice chips, popsicles, anything to get your mouth cold and your upper esophagus cold. Believe it, do it. Put ice in your mouth until you're so sick and tired of ice, and then do it again. Put some more in there. Because if you can keep the melphalan from attacking the cells in your mouth and the upper esophagus, throat area, you lessen the chance of developing mouth sores. And you will so much appreciate that the next week or two as you recover from your plan. Stay on top of your anti-nausea and pain pills. I always thought I could be tough, and I could deal with the pain, or I could deal with running to the bathroom and throwing up every time. But then I was always behind the curve, and I could never get caught up. And I learned early on that I knew I was going to get nauseous after a snack. So before the snack, before a meal, I would take the anti-nausea pill, and I would stay ahead of it. And I didn't get sick. I didn't have the constipation. I wasn't in pain because I was proactive and stayed ahead of the curve. Yep, I know that some of the drugs can be addictive forming. I was aware of that, and my medical team was able to help me stay off of being addicted. But physically, I felt better, and mentally, I felt better because I didn't hurt. I didn't have to worry about running to the bathroom every time I ate. The other thing I mentioned is that from the very first appointment, my wife and I kept a notebook, and we every appointment, every issue that I had, and I can go back 10 years and tell you exactly what the physician told me, or what my blood pressure was, or what my adverse reaction was to a drug anywhere along the path. The other thing is that I did a carrying bridge post. And posting my thoughts and fears and anxieties on carrying bridge to my friends helped me relate, but also tell them what I was going through. So if the physician told me something and I wanted to relay that to my carrying bridge blog, I felt I understood it better trying to explain it to somebody else. The immune system consumes a lot of protein, and after transplant, your immune system is severely compromised. So you need protein to help build and repair the immune system. The more protein you can consume, double, triple the daily recommendations for non-cancer, non-transplant patients, gives your immune system the bit of a bounce that it needs to rebuild itself quicker. Now, you don't have to eat 7 T-bone steaks a day, but there are lots of other sources of protein besides meat. You've got Greek yogurt, cottage cheese, eggs, milks, almond, pumpkin seeds. There's fish and shellfish and chicken and turkey breasts and peanuts and peanut butter and legumes, beans. Your team should have a dietitian that can help you find those protein-rich meals, foods that will help you rebuild your immune system. And you've got to stay hydrated. You've got to help your kidneys function and flush out all the stuff that's in your body. Staying hydrated also helps if you have issues with low blood pressure. So if you go from a standing or standing up, you don't want your blood pressure to drop. Teas and coffees and caffeinated drinks don't really help you, but there are ways you can consume liquids to stay hydrated, adding a lemon, adding a lime, Crystal Light, some lemonades, some flavored waters, tonic water will help you stay hydrated. And part of the physical and mental well-being is to exercise. You don't have to hit the gym the second day after transplant or run a marathon a week later. But if you sit in the recliner and become a couch potato, your mind goes into places you don't want to go, and your body doesn't want to consume anything because you're not exercising. So simple acts like getting up and walking around the house, walking out to the mailbox, depending on your situation, going to the mall and walking all the other seniors, throwing the ball, playing catch with the dog or a grandchild. All those will get you active. Your body will start to heal a little quicker. Your mind is thinking about what you're doing right then and not necessarily, woe is me. And I think that exercise in moderation and then slowly increasing it causes you to burn some energy. So now you're hungry. Now there's a chance to consume more protein. And it is a good vicious cycle that will help you feel better. When you come home from your transplant or anywhere along the transplant journey, there will be a host of friends, neighbors, coworkers, friends from church or a community club who will feel the need to offer help. Don't be so proud that you say no, you can do it yourself. Take them up on their offer. Let them sort the laundry, do the laundry, clean your refrigerator, run for some groceries, mow the lawn, wash the car, take the dog to the vet, pick up some medicines for you. They will feel a whole lot better knowing that they can help you navigate your journey. And that's a little bit less pressure on you that you have to worry about doing all those things and how will I do those things. If you tell them no enough, they're going to quit offering. So when you're ready for it, take them up, accept their generous help. And understand that your caregiver is doing double duty. He or she has to worry about you, your recovery, how you're eating, sleeping, the medicines you're taking, all that stuff. Plus, take care of themselves. And a lot of times those caregivers are burning the candle at both ends. And I don't think any of us patients really understand what the caregiver is going through until we're close to the end of the journey. Someone who wants to help, let them come and sit with you and play a card game or just listen to you or read a book. Give your caregiver a chance to escape, take a nap, go to the barber, beautician, do something for themselves for a couple hours so that they can recharge their battery and be a better caregiver to you. Also understand that as a transplant patient with a compromised immune system, you need to be very careful about others that may have cold or flu symptoms. and you may want to wear a mask. But also understand that you've got to have some balance. You can't isolate in a bubble for a year or 2 years while your transplant takes a full control of your system. Be wary, be cautious, but don't isolate. You need to have some balance in there. The other thing that I found is that I created on my computer a little business card size piece of paper that had my name, my phone number, my email, maybe my Facebook address, and my Carrying Bridge address. And as I met people in the clinic that either wanted to connect up with me later on or I wanted to connect with them, it was easier to just give them that slip of paper with my contact information on it than to try and find a pen, try and find a pencil and paper and rack my Chemo Brain to write down their information, or even try and remember it 3 or 4 hours later on. Chemo Brain is real, and it affects us in different ways at different times. But that simple little calling card allowed me to give that person some information, and I could flip it over and put their information on and put it back in my wallet. It really helps out. There's a tendency to look at another transplant patient or listen to another mentor and say, okay, so yours was super easy. You breezed right through it, or yours was horrendous. I guess I'm going to have the same problem. Do not compare your journey or your expected journey with someone else's. Every one of us is different. Every one of us will react to the medicine slightly differently. And just because someone you met had a fantastic or a horrific transplant does not mean that you will have the same journey. Talk to your medical team. Be your own advocate. Don't suffer in silence. Let them know what's going on, and your journey will be your journey. And for all practical purposes, stay the heck off online search engines. Most medical professionals will tell you at the first visit, do not go online. The information online is outdated. It's scary. It's usually worst case scenarios. My wife tried it, and after half an hour, she was in tears and just turned off the computer and said, not going there again. And we never did. Our medical professionals gave us good information and good sites to go to for current information and good help. Sites like the LLS.org, one of the sponsors for today, myeloma.org, myinteract.org, and of course the National Bone Marrow Link.org. There are legitimate sites that you can go to, but don't just Google your disease and transplants. Remember that you're not alone. You're not the first. You're probably not going to be the last. Others have come before you, and there'll be some trials and tribulations. I think positively the whole time. I try and be as positive as I can. I have mentored others with multiple myeloma, and I listen to others that have issues and questions and concerns. I try and offer some advice. You know, my goal is that my disease, multiple myeloma, will not be my demise. Something else will get me. I told Peggy Burkhart, the program manager several years ago, that I view my transplant is a bit of a card game. I was dealt a hand of cards, and I played that for 50 some odd years, 59 years. And then I was given an opportunity to turn one card back to the dealer and get another new card. And I played that hand for another 7 years. And then I was given another opportunity to turn another card back to the dealer and get another card in return. And I'm playing the hand that was dealt to me. And I'm having fun. I'm doing everything that I want to do. And I intend to grow old and see my grandkids graduate high school and possibly college, maybe get married. I'm positive that my disease, my transplant has helped me manage my disease. And I believe that if you are active and think positively, you enjoy the same journey I have. And that's all I have. Thank you very much.
Thank you so much, Todd and Regineak. Wonderful, wonderful information, and we appreciate all of you being here today. We are now entering into the question part of our program. I see many of you have found the question area, but maybe Kevin can just give a quick little intro in case anyone's confused about how to ask questions.
Absolutely. If you'd like to ask a question at this time, please type it into the Ask a Question feature on the left side of your screen. Once again, if you'd like to ask a question at this time, please type it into the Ask a Question feature on the left side of your screen. Back to you, Jennifer.
Thank you so much, Kevin. I'm going to ask our first one. Abby, I think this is probably a great question for you. Does a bone marrow transplant affect testosterone levels in men post-transplant? And if so, does it return? And can you do replacement if it does not? And this person had an AML diagnosis.
Thanks, Jennifer. That's a great question. Yes, the simple answer is yes. Testosterone levels can certainly diminish post-transplant and even in post-chemotherapy. It is safe to do replacement. What you would do is need to be seen by a urologist or a knowledgeable provider in the transplant team, or even PCP who understands testing the blood levels of the testosterone and knowing what your level is, and then you can have replacement.
All right, thank you. I have another one here for you, Abby, that someone is asking about having issues with eyes after transplant, with chronic dry eye with the GVHD. And she says that oncologists and eye doctors have not been able to diminish the pain. Is there any new protocols available for dry eyes?
Well, certainly this is something that we see often, although I am not an ophthalmologist of any kind, and I do rely on our ophthalmology team and our multidisciplinary clinic to give me these exact answers. If you are not being seen by a provider specifically who understands GVHD, then I would start there. I know that there are drops, but I don't know of certain treatments to help with pain. Certainly, though, we do encourage our patients to get opinions at sites that have specialists that are specifically regarding GVHD if you haven't done that.
Right. I also want to just add on to that. We had an iGVHD program about a year and a half ago, and that should be on our website too at mbmtlink.org, mbmt.org. But anyway, so you can access that program, and then in addition to that, the Bone Marrow or BMT InfoNet has a search engine on their site for specialists. If you're not sure where an ophthalmologist that specializes in GVHD is in your area, you can go on their site and you can do some searching as well. Reginiak, this one I think would be good for you. they're asking you to elaborate a little bit more about survivor's guilt. Is there any additional tips you would like to offer in regards to survivor's guilt?
Absolutely. And guilt is a common feeling experienced by cancer survivors, and there are ways to address it. One of the things that I always remind survivors, feeling guilty doesn't mean you deserve to, right? And so acknowledging the guilt that you feel, having survived when others didn't, but also it's so important to remind yourself of your life's purpose, as well as engage in activities that are meaningful to you, right? For some, it's giving back to others that may help better cope with survivorship guilt. I also recommend maybe speaking with a mental health professional or someone on your survivorship team because what you want to do is sit with a mental health professional who can help you explore and look deeper into exactly what you're struggling with so that you can begin to move past it.
Great.
Jennifer,
yeah.
if I can add to Regineak's comments, I met probably 10 people in my first transplant process, and 6 of those are no longer with us. Again, we all had different journeys. We all had different comorbidity factors. I was sorry to see them go and not have the same outcome that I had. But I felt that the way I could avoid that guilt was, in a sense, kind of giving back, helping someone else, mentoring peer-to-peer. If someone who just discovered that they needed a transplant wanted to vent or listen or talk, I guess that's the way I beat the survivor's guilt, is to give back a bit.
Thank you, Todd. I appreciate that. Which, by the way, Todd, I see someone asking if you feel comfortable sharing what maintenance medication you're on.
Sure, no problem. I'll talk to anybody anytime about my journey. After my first transplant, I was prescribed Revlimid, 10 milligrams, 21 days on, 7 days off. I tried that for 3 months. I was up to 8 Benadryl a day to control the itching, and I finally told my oncologist that my quality of life was not worth the itching and 8 Benadryl a day, so I ceased maintenance, and I got 7 years without maintenance. After the second transplant, I went back on Revlimid, 10 milligrams, 21 days on, 7 days off. And I tolerated it. I don't know what changed, but I had no issues with the Revlimid. And I was on that for about 14 months before a checkup and bone marrow biopsy showed some genetic changes in my DNA chain. It was caused by the Revlimid and the cancer fighting. So I went off of Revlimid, and I'm now on Velcade injections twice a month or every 2 weeks, and I have had no issues with that at all.
Great. Thank you so much for sharing that. Abby, I have a question here. Is MRD negative a good sign of successful treatment in remission?
I actually, could somebody clarify what MRD is in that question? I don't know what that is.
You know what? We'll see if they write in and clarify that, but they just put MRD. So
Okay.
We will wait to see on that. But also another question for you. When should a haplo-related transplant recipient receive vaccinations?
So I think the best answer is to certainly check, not knowing the situation, to check with your team as to where you're at with your vaccination schedule. Generally speaking, there's a stepwise, both from a very frequent vaccination schedule that moves essentially like within the first year quite frequently, and then moves out further. So depending on where this person is, it's very specific. I see that MRD, I just had not heard that term, is minimal residual disease. It's not something that, again, in like the survivorship setting, I'm well versed on. Again, this would be something to discuss with your treating team. I think that I would have to rely on that specific personal history to talk with their team. I'm sorry, I can't elaborate just because I don't know the whole history.
That is okay, but we appreciate your thoughts on that. And this is going to be a three-part question. We are going to go back in a moment to the one question I see. Actually, maybe we'll do that really quick before we hit this next one. It looks like that person meant minimal residual disease. And so the question is minimal residual disease negative a good sign of successful treatment? Does that help at all with that question, Abby, or would you recommend them talking to their physician further on that?
I do believe that it would be useful to talk with the team just because I don't have their whole clinical picture in front of me.
Okay, thank you. And this one I'm going to ask all three of you. Maybe we will start with Todd. You know, sleep issues can be so common for people going through this journey. Did you ever have any issues falling asleep, Todd, or staying asleep?
Yes and no. I did initially staying asleep. I could fall asleep at the drop of a pin. Anywhere I sat down, I'd fall asleep. But getting good, long evening sleep was difficult. What I found was that I was eating smaller meals during the day, so I didn't have a huge meal before dinner time or at dinner time. I didn't eat a big meal or a snack, there's lots of sugar, ice cream, etc., before I went to bed. And then I also did some exercises during the day so that I was a little more tired. I tried yoga for a while just to kind of relax and zone out a little bit. I don't know that any one of those issues made it easier. I have no problem accepting drugs, but I don't take them haphazardly. So I'm very careful with the nighttime sleeping drugs or melatonin, but kind of a combination of all that, I was able to finally get some sleep, get some exercise, clear my head, minimize my heavy meals before bedtime, and just relax my head, relax my brain. Keep those voices way in the background.
Good plan. How about you, Reginiak? If someone called you asking for advice with sleep, I know this person asking the question had said they've tried melatonin and Ambien and they're still having a hard time. Is there anything you would recommend to people calling you with that concern?
Yes, absolutely. So when it comes to sleep issues, I would certainly recommend speaking with their provider to perform any tests to determine if there are any, maybe if it's a medication or anything, an iron deficiency, anything that can be contributing to sleep. And I'm not sure for this specific question if the person is asking if they're not able to sleep or if they are fatigued. Do you know?
This looks more like a sleep issue, even though we know fatigue is difficult too.
Yes.
And if you want to speak to that, pretty much almost everyone experiences fatigue.
Yes. Yes.
It's universal.
Yes, absolutely. Yes, so I would really recommend what Todd mentioned. A lot of times when I'm speaking with patients who have, or survivors who have sleep issues, I would certainly recommend sometimes a nighttime routine, right? And so how much stimulation are you giving yourself before it's time to rest, right? Also looking into whether or not there is a need to exercise. I would say there's a host of things that I would speak with the patient about when it comes to sleep issues, but certainly recommend, just to add to that, if there are more so like thoughts that are keeping survivors up at night, certainly I would recommend speaking with the counselor if it's more so related to, right, the anxiety or the inability to shut your mind off when it is time to rest. So I would certainly recommend counseling and speaking with, your provider.
Okay, thank
Jennifer,
you.
the other thing is,
go ahead.
I was going to mention the other thing that my wife just reminded me of is that 2 of the anti-nausea medicines, Ativan and Benadryl, also help with some sleep issues. So they kind of just take a little bit of the edge off, as well as you're not nauseous.
Oh, very true. Thank you for that. And Abby, did you have anything to add to the sleep or fatigue issue?
Thank you. I was going to add just a couple of things. I think in medicine, we're trained about sleep hygiene. This is a term that some people may be familiar with, which is what Regineak is talking about, creating a routine for sleep. And sometimes that helps really, really well, eliminating blue light, the iPad and all that. But the other piece is that there's a lot of emerging data and clinics about sleep medicine, specifically cognitive behavioral therapy. And while this doesn't mean don't take melatonin or Ativan, it's a focus on techniques of helping to stay asleep, falling asleep. And you could ask in your area about this, because there are providers now, and some of it is done through telemed and more accessible. So you might want to ask about a sleep specialist. This is different than going for a sleep study for sleep apnea. But I agree with Regineak, you have to find the impetus for what is causing the symptom. It could be the steroids you're on, which then make you hyper, and Todd is right, Ativan and Benadryl can help calm that down. But it could be psychological, it could be concern, it could just be that you need some help resetting your sleep. So talking with a sleep specialist could help.
Absolutely. Thank you. Also, another question for you, Abby. Someone is asking, they had a Haplo transplant, and they're curious when they should start seeing specialists such as dermatologists, cardio, bone density. How would you recommend them to have that schedule?
So I think the best way to do it is to, again, this is very, personalized. So just sort of generally speaking, depending on how far you're out, usually at least the year mark, I would mention getting a baseline bone density study done. If you haven't had one, talk with the team about it. This is usually done with the transplant team. They'll be very comfortable. What was the other question? The specialist. So if there's not an active issue, for example, GVHD of the skin or the mouth, et cetera, then everybody should see a dermatologist to have their skin looked at, because of all that you've gone through. It can affect the skin. But if there's a actual symptom, it should be addressed right away. There's no time frame for waiting.
Thank you so much. And this one I'm going to start with, go ahead, Todd.
I was going to say, for any of us that grew up in the 50s and the 60s and enjoyed the sun, all of the drugs that we take to treat our cancers are going to make us more susceptible to skin cancers. So by all means, you should be seeing your dermatologist at least annually. I see mine every 6 months.
Thank you for that. And actually, Todd, my next question is for you. So many people think that when the cancer is over, you just bounce back. And when the transplant's over, you bounce back. And this person asks, what is the quickest way to educate the general public when necessary on what this journey is really like? She's saying that there's a situation she's dealing with where whether it be like work situations, whether it be dealing with legal issues, just educating people that people just don't bounce back right away. How do you handle that in your life?
That's a rather open-ended question, like an octopus with a lot of legs on it. That's a little hard because I guess first of all, I tried to make sure that I was each day getting a little bit better physically. I didn't let my mind wander into places it shouldn't be. I didn't get the woe is me. I just kept trying to build myself up positively every day. And as people asked me, or my coworkers asked me, or the financial institutions said, "Where's the payment?" I just tried to be frank and honest and not defer the questions and say, "Look, I am battling an incurable disease, and I've gone through a transplant, and I'm coming back, and I can do some of this stuff, maybe not as quick as I've done before, and I will provide you with the work plan you're asking for or the payment you're asking for, but I need a little bit of leeway and some patience, honestly, as I rebuild my body to get back to a new normal." I found that most people are accepting of an honest, heartfelt answer. You start skirting the issues and lying a little bit, and pretty soon they see through that. So that's what helped me with some of the situations I ran into.
Thank you. Reginae, do you have anything to add?
Do you mind repeating the question for me?
Oh, sure. It was just talking about, a way to educate people in a quick way when necessary that the cancer just doesn't go away overnight just because the transplant's done.
Yes, absolutely. And you know what, and this is not to add something else for the survivor or even their caregiver to add to their role, but a lot of the education will come from survivors being vocal about their experiences and letting, those they're in community know, hey, this is not, everything doesn't just stop once I'm in survivorship. I also recommend, if you're familiar with a webinar or educational program, right, that is providing education on survivorship, like this particular webcast, inviting your family, your friends, your community to participate, to listen in. Those are all ways to help educate the public. Health fairs are another way to educate the public. And so those would be tips that I would recommend in terms of helping other people truly understand survivorship and all that comes with it.
Thank you. Thank you, Regineak. And also another question for you and a compliment. Someone says, Thank you, Regineak, for your enlightening words. And they're talking about having PTSD and really suffering with it. Is there anything you could elaborate on with PTSD treatment and what you have used with the people you support at LLS?
Absolutely. And at LLS, we do get calls from patients who are struggling with anxiety and PTSD. And so for the most part, or some of the things that I would recommend, because I was reading this question and I noticed that the individual did mention that, there are painful memories that are being evoked, right? And so also not feeling like the treatment or the therapy that they've been in for the past 3 years has helped. And so I find that a lot of times with cancer patients and survivors, there is a fear to speak up about what you're experiencing with your healthcare team because you don't want to come off as being challenging or difficult to work with. But in this specific case, I truly recommend, because it seems like this individual has been working with someone for 3 years, and so there's a rapport that has been established with the mental health professional. And so meeting with your therapist or meeting with whoever your social worker, right, and being honest about what you're feeling, but also being honest and letting them know, hey, I appreciate all that has been done, but it doesn't feel like anything has been effective because I'm still feeling these painful memories, so that you can explore, right, new strategies or techniques that really can be applied to help cope with PTSD, right? When coping with PTSD, there may be a specific form of psychotherapy that is needed, right? And so there are many different types of therapy techniques in psychotherapy. And so you want to make sure that if you are working with a mental health professional, that they are providing you with a technique, a proven technique, right, that is going to assist specifically with PTSD. Sometimes, we don't oftentimes talk about sometimes the need for medication, right, or anti-anxiety drugs to help manage PTSD symptoms. And lastly, I would also recommend getting connected with a support group to help cope with the emotional stress of survivorship, right? Again, a support group is really a safe place where you can connect with other survivors who have that shared experience. And you can also learn what are tools or strategies that they are using to cope, and whether or not this is something that I can implement in my personal life to better cope with symptoms of PTSD and anxiety.
Thank you. Great ideas here. Another one for you, Regineak. Resources you're available or you are aware of that exist to help someone with trying to re-enter the workforce after a transplant.
Absolutely, yes. Firstly, I'm so excited, for this survivor who is thinking about entering the workplace. Absolutely, so excited. And so, firstly, I always recommend, as a person with a history of cancer, you want to familiarize yourself with your employment rights, right? What are ways that I can advocate for my rights in my workplace, right? And so LLS actually has a section of our website where we discuss employment rights, right? And so ways that you can advocate for yourself as you enter into the workplace. And so when you think about returning to the workplace after a cancer diagnosis and when you're in survivorship, you absolutely want to be patient with yourself, especially if you're looking for a new job, right? It may take some time to find one that is a good fit for you. If you're returning to an existing job, you may find it takes some time to get back up to the speed and to work at your pre-diagnosis capacity. And so you want to be patient with yourself. We also recommend here at LLS an organization that is phenomenal. The organization is called Cancer and Careers. And Cancer and Careers empowers and really educates survivors how to thrive in their workplace. They provide really good expert advice. They also provide educational events. And so I would certainly recommend connecting with Cancer and Careers to learn about your employment rights as you re-enter the workplace, as well as being patient with yourself.
Thank you. And Abby, any thoughts for patients dealing with cognitive issues post-transplant?
Yes, this is really actually more common than I think people address. Like Todd was saying, it is real. The first thing would be to ask your providers about a neurology team that they work with, just to have a basic evaluation, making sure there's nothing causing any, short-term memory issues, or perhaps some people, when they get tired, they even have some word-finding difficulties that can feel very scary. So a good neurologist, just to do an initial consultation. There's some cognitive rehab and different things available to help. This is a much more recognized lingering side effect for patients, so certainly something to mention because there are specialists to help.
Great, thank you. And Todd, what about you? Any more thoughts about how you coped with Chemo Brain?
You know, the medical to brain, and I thought that's funny. I'm still young, and that's not going to happen to me. That's some other patient. And then I would meet, it could be a year after the transplant. I would meet someone, and we'd talk, and then I'd go to respond to them, and I couldn't come up with their first name again. And I thought, what the heck? How come? And it's like, okay, so I finished the conversation without ever replying to them by name. And then some other issues, similar instances cropped up, and I realized, as my wife told me, that Chemo Brain is real. There are times I just can't remember something that was either real short term or, a couple days ago. I guess I don't really have an answer other than I concentrate. I kind of think about it as I go along. And if I miss something at the spur of the moment, I know, okay, don't get frustrated. It'll come back to you in a couple of minutes. And I usually carry on with my task or my conversation, and then it'll come back to me. I'll remember that person's name, or I'll remember what the measurement was for the piece of wood that I'm working on in the shop. And I know that it's real. I recognize that there's times that I just can't come up with the answer. But as long as I kind of go with the flow and don't get frustrated, it comes back to me very shortly.
Well, thank you for that. I know some people have shared with us, too, how they are big list makers after going through something like this. Or I've heard one gentleman tell me how everything in his house has its place now, because if he puts his keys down in random spots, he will never find his car keys. Or some people talk too about like leaving themselves little messages in their phone. It's really, there's all kinds of little strategies that can be found. But I encourage you to just talk to your team, talk to other survivors, and you'll hear some great tips and learn more on how to deal with this, because Chemo Brain is real, just like Todd said. But I cannot believe it. We are already at the end of our program here today. I just want to thank Abby and Regineak and Todd. What an amazing program, just full of great tips. And we are so thankful that you were here today and to help everyone on the call. I thank our sponsors and our partners, and I thank all of you for being here today. If we can be of any other support, please feel free to reach out to us. I have my email on the slide here, and we also are going to be sending you a survey. And so if you could fill that out, let us know about future programs you would like or anything we could have done to make this program a little easier for you today. We are open to your feedback, but I thank everyone, and thank you, Kevin, for helping us again, and I hope you all have a great day.
Thank you. That does conclude today's teleconference and webcast. You may disconnect your line at this time and have a wonderful day. We thank you for your participation today.